the Hippocratic Oath, which is, he was one of the founders of modern medicine, how we think about modern medical thought. And then if you move forward and you go to 1814, Dr. James Tilton was a Surgeon General of the US Army. He directed all hospital surgeons to take weather records. And the reason for that was, at that time, they understood that with changes in temperature and changes in precipitation, they were seeing outbreaks of certain diseases. Those diseases were malaria and yellow fever and things like that. Now, as what we know today, those diseases are spread by mosquitoes. Dr. James Tilton and his colleagues didn't understand that those diseases were spread by mosquitoes, but they did understand that with changes in weather, changes in temperature, changes in precipitation, that you saw outbreaks of those diseases. Now you move forward, and today we understand that climate impacts our health in a variety of different ways. There's everything from the direct impacts to the indirect. And I'm going to talk about that in a little bit more detail in a bit, but the direct are those things that hit you immediately. Those are the things that send people to the hospital. Those are the things that, when they occur, the impacts are immediate. That's extreme heat, air pollution, extreme weather. Now the indirect, those are the things that take longer to manifest. Those are delayed or can potentially take weeks, months, or even years to fully understand the impacts. It's the spreading of disease through changes in habitats for animals that potentially carry some of these diseases, to disruption of food supply or water supply, to even disruption of well-being with mental health issues, which we're going to be talking about throughout this lecture. And so I think one of the best examples of trying to identify that delayed or that direct versus indirect is actually Hurricane Maria. Many of you are probably familiar with Hurricane Maria. It happened, I believe it was in 2017. It hit Puerto Rico. It had significant impacts on that particular area. When they did the initial analysis, they believe that 64 people died because of that hurricane. But then about a year later, they came back and they were starting to evaluate all the different ways that people were dying because of that hurricane, and they noticed the numbers were much greater than just 64. And there was a variety of different estimates that were out there, anywhere from about 3,000 deaths to more than 3,000 deaths that were attributed to that hurricane. And so some people might be asking, well, what potentially, why would you change those numbers? Why would you go from 64 deaths, which are the direct impacts, to maybe upwards of around 3,000 deaths with the indirect? Well, there was a study that was done a few years before Hurricane Maria hit that was looking at all tropical cyclones, so these are hurricanes, and what they noticed was there was actually a lot more people that die when hurricanes or tropical cyclones hit a coastal area than from the delayed or indirect health impacts than there were from the direct health impacts. And here is just some of the ways that they looked at, or some of the different ways that people died from 1963 to 2012. So cardiovascular incidents, deaths associated with evacuation, vehicular incidents, power outage problems, and then a variety of other issues as well. We also know when things like Hurricane Maria happen, they have significant impacts that can potentially spread across the state or across the world, or across the country or across the world. And so this particular figure here is showing where everybody, when Hurricane Maria hit in Puerto Rico, where all the different people from Puerto Rico were displaced and relocated to after the hurricane. And so as you can see, we saw a large uptick of people from Puerto Rico going all across the United States. And this just shows that even though a particular climate or natural disaster, even though it occurs in a certain part of the world or a certain part of the United States, it still has impacts and ripple effects all across the country and all across the world. And here in the Central Plains, we're definitely familiar with that. We had the Missouri River and Central flooding that occurred in March of 2019. That particular flood cost at least $10.8 billion of economic loss for the region. There were at least 3 deaths, and we're going to talk about that. Those were the direct deaths, but as we were discussing with Hurricane Maria, the direct really doesn't capture the full breadth or the full impact of any particular event in the context of human health. And some of those delayed responses or indirect health responses can actually far exceed those direct deaths. And then there was also hundreds displaced due to this particular event as well. And we also know about some of the other significant impacts that happened throughout the region as well. Internationally, we know that droughts have likely killed more people than any other climate or weather-related disaster over the last century. And as many of you could potentially guess, that's due to famine and malnutrition, especially in a lot of developing parts of the world. Floods are second, and then followed by some of the other climate-related disasters that we see. But here in the United States, and this is actually surprising to a lot of people, heat waves kill more people in the United States than any other climate or weather-related disaster. So this is from 2004 to 2013. Heat waves killed more people in the United States than tornadoes, hurricanes, floods, winter storms, cold waves, all these other things. And as you can imagine, we have, one of the reasons for that is tornadoes, hurricanes, floods, those are very specific for a certain location. They might occur once a year, or maybe once every couple years. Heat waves, however, occur all across the United States, multiple times every year. Here in Nebraska, we face multiple heat waves every year, and Illinois, New York, Florida, California, every year we face heat waves in all these different locations, and potentially multiple heat waves in each of these locations. Now, what we should also mention here, which you can potentially notice, is that even though heat waves are the #1 killer, during that same time span, hurricanes cost the United States more financial loss than any other weather climate-related disaster, with almost $400 billion of economic loss. Then heat waves and drought were second with almost $80 billion. But heat waves and heat also has an impact on our mental health as well. People with mental illness are especially susceptible to heat. There's been a number of studies that have shown an increase in aggression during warmer periods of the year, and especially during heat waves. People with severe mental illness that have, such as schizophrenia, they're at higher risk in hot weather because some of these medications that are associated with some of these psychiatric medications are actually, they're not as effective, or there's potential, they're interfered in some way with higher temperatures. So they're not as, they don't work as well under some of these higher temperatures. The people with dementia are at a higher risk of hospitalization and potentially death during heat waves. And then there's also other work that has been done that has actually shown that you see an increase in preterm births, low birth weight, and maternal complications during extreme heat events as well. So I'm going to step back for a second, and that was just basically to highlight the, some of the ways that climate is impacting our health. But now I need to actually, I think, talk a little bit about what is climate. So to start that off, we have to define the difference between climate and weather. As was attributed to Mark Twain, climate is what you expect, weather is what you get. Weather is the current condition of the atmosphere right now, outside. That's weather. It's extremely variable, and climate is the behavior of the atmosphere over longer periods of time. So here in Nebraska or anywhere, seasons are climate, year-to-year comparisons are climate, and geographical differences are climate. So, what does it look like in a Nebraska summer versus a Nebraska winter? What's it look like if you live in Florida for a year versus living in Nebraska for a year? And what's it look like this year compared to the next? Now, we could look at any one particular day, and that might be variable, and it might not be an example of the average. So we might actually find a day in a Nebraska winter that is warmer than an individual day in a Nebraska summer. But if you live there for the entire season, you'll realize that that was just an anomaly or an outlier. And the same thing, you might move to Florida and you would realize that one particular day in Florida was cooler or colder than here in Nebraska. But if you looked at over the entire year, especially over the winter, you would notice the difference as well. And then you have these three terms here: climate change, climate variability, and extreme weather. Climate change is the long-term continuous change of the average. That's the definition of what climate change is. Climate variability is a fluctuation above and below the long-term average. And then extreme weather is any phenomena that is outside the historical distribution. So these are flooding rains, droughts, heat waves, things like that. And there's a variety of different factors that influence this. And so what I'm showing here with this figure, we're looking at the global temperature trends from 1950 to about 2015. And one of the things that you'll notice is that there's a lot of variability from one year to the next. That's climate variability. Some years it's a little bit colder, some years it's a little bit warmer. But you'll notice that there's an upward trend over that 50-year period, 50+ year period. That's climate change. That is a change over time. And then you might be asking, well, why isn't it just a progressive increase in temperature? Why is there so much variability? Well, that's because our Earth system is really complex. And there's a lot of different factors that are interplaying there that influences the temperature and precipitation patterns from one year to the next. One of the examples that's given here is El Nino. And so some of you are probably familiar with El Nino and La Nina. And that has a lot of impact on what our temperature, what our climate is for the entire globe. And I'll talk about that just in a second. But just so you notice, El Nino, global average temperatures are a little bit warmer. La Nina, global average temperatures are a little bit cooler. And so this is El Nino and this is La Nina. El Nino is basically the ocean temperatures near the Pacific are a little bit warmer over towards South America. La Nina is basically the ocean temperatures in the Pacific, in the equatorial region of the Pacific Ocean, are a little bit cooler. And these small changes in ocean temperature in this part of the globe actually influences the temperature and precipitation patterns for the entire Earth. And the reason I bring this up is just to talk about some of that complexity that we have in our Earth system. So sometimes you get El Nino, sometimes you see there's a variety of other ocean oscillations and temperature patterns, and there's currents and atmospheric currents, all these other things that interfere and influence our global climate. Not just these two, but that's why we have so much variability from one year to the next, and we don't just see a progressive increase. And so what we see here in North America during El Nino, during the winters of when we have El Nino, it's actually a little bit warmer. In the northern part of North America, it's a little bit drier in the eastern part and a little bit cooler and wetter in the southern part. And then La Nina, we actually kind of see the opposite of that. So when do you think we first discovered the link between our Earth's climate and greenhouse gases? I'll just pause for a little bit. And this is kind of a tricky, maybe a tricky question. We'll see how.
We have about half the people voting right now, so we'll leave it open maybe 15 or 20 more seconds and let everybody get a chance.
Because this is one of the things that everybody talks about, right? Everybody talks about that link between our Earth's climate and greenhouse gases. We know that our Earth system has been changing. We know that our temperatures have been changing. And we know that there's a variety of different things out there that are potentially related to that. Oh, wow. Nice. Nice. Excellent. So being a scientist, I always enjoy science, and I enjoy quotes from scientists and mathematicians of the past. And one of the quotes I really enjoy is Isaac Newton, who said, "If I've seen further, it's by standing on the shoulders of giants." And basically what Isaac Newton is saying is that any scientific discovery that he made was because of some scientist before him. And that's the way science works. You're always discovering and learning the next new thing based off of the information that was provided before you. And when we talk about greenhouse gases, we've got to always go back to these three individuals here. Fourier, who is a French mathematician, physicist, who was around 1700 to 1800. Tyndall, who was a chemist in the mid 1800s, and then Arrhenius, who was in the late 1800s, early 1900s. So a lot of us have heard about this greenhouse gas concept, and it's basically that there are certain gases in our atmosphere, water vapor, ozone, carbon dioxide, nitrous oxide, methane, that are in our atmosphere that trap outgoing infrared radiation. So the Earth's surface, we have radiation coming in, it's hitting the Earth's surface. Some of that is absorbed, some of that is reflected back out into space, and some of that is trapped in our atmosphere. And the reason we know about this is because of these three individuals. Fourier was, say early 1800s, and he was able to measure the amount of radiation coming in from the sun. And he did a calculation where he calculated the amount of radiation coming in from the sun minus the amount of radiation that was going back out into space. And when he ran this calculation, he determined, he was like, the Earth should be much colder than it is. So he realized there must be something going on in our atmosphere that's capturing this outgoing radiation. But we couldn't identify what that was until Tyndall. Tyndall came around in the middle of the 1800s, and he was able to actually identify what those gases were. And that's where we got the greenhouse gases that we know today, was through the work of Tyndall. But then Arrhenius came around at the turn of the century, 1900, and he was in Northern Europe, and Arrhenius is a chemist, physicist, and he's looking around and he's seeing all this coal being burned. And he realized that coal is carbon, and when you burn it, CO2 is emitted. And he knew of the work of Tyndall, and he knew of the work of Fourier, and he was like, well, if we're seeing more CO2 in the atmosphere, and we know that that's a greenhouse gas due to the burning of these fossil fuels, he's like, we should see a progressive increase in temperature. And he actually ran the calculations. He had physics-based calculations, and that's what he was able to actually figure out, is that with an increase in CO2 in our atmosphere, we should see a progressive increase in our temperature as well. But we couldn't actually measure what was going on in the atmosphere until Charles Keeling. Keeling came around in the mid 1950s, and that was his task, was to actually be able to identify what's going on in our atmosphere. And so he actually took measurements, and he devised a way of measuring greenhouse gases in our atmosphere. And one of the first gases that he focused on was CO2. And what he saw was this pattern here when he first started taking those measurements. At certain times of the year, we see a decrease in CO2, and other times of the year, we see an increase in CO2. And what that is basically the Earth is breathing because we have photosynthesis. So as all of us are familiar, there's certain times of the year where you see more plant production, you see more green material on Earth, and that green material is sucking up that CO2 from the atmosphere. And then other times of the year during winter, it starts releasing that CO2 back into the atmosphere. And so that's the first thing that Keeling discovered. And then the second thing that Keeling discovered was this, that every year that he was taking measurements of CO2, the concentrations got greater and greater. So all the way from back when he put this station up in Mauna Loa, Hawaii, to present day, where that station is still functional and operating, we've seen an increase in CO2 in the atmosphere every year. And so in April of 2020 of this year, CO2 concentrations at this station were 416 parts per million, and the year before it was 413 parts per million. And You know, a lot of people are like, well, what does that actually mean? Well, what it means is, one, we know that there's a direct relationship with our temperature and the Earth's and CO2 in the atmosphere, and we've seen that for historically as well. So we can actually take ice cores, and when we take ice cores and we look at the bubbles within the ice cores, you can identify roughly what the temperature was due to a variety of different things. You can also identify the CO2 concentrations. And so when we look backwards in time, what we've seen is that when CO2 concentrations were highest, temperature concentrations on Earth's surface were highest as well. And we see that over the last 400,000 years. And one of the things that you might notice is over that 400,000 year period, CO2 concentrations never exceeded 300 parts per million. And we know right now we're over 400 parts per million. And so moving forward, using some of those same physics-based models and a better understanding of our Earth system, if we look at what's going to happen as far as increases in CO2 and other greenhouse gases, we expect that temperatures will continue to rise over the next century as well. And this is just basically showing how well our models work. So this is our observation here in the middle. These lines are the observation of our Earth's surface. And then the kind of orange and blue bars are the model data and trying to predict our temperatures. And as you can see, the models, similar to the models, the more advanced version of the models that Arrhenius is running, fit well with the changes in our temperature over time. And if we ran those models without CO2, without changes in CO2, they would basically go flat over this last 50 years. And so where is that CO2 coming from? Well, it's coming from the same place that Arrhenius thought that it was coming from back around the turn of the century, which is through fossil fuel burning, carbon dioxide from coal and oil primarily. And the reason we know that is we can look at the signature of the molecular weight of those carbon molecules, and we can see that those molecules have been shifting over time due to burning of fossil fuel. So what do we know? We know the Earth's surface has gotten warmer. We know that increase in temperature hasn't been homogeneous over the entire United States or even the entire globe. Certain places have warmed at a higher rate than others, and some places have actually even seen a little bit of a cooling. And that's because of the complexity of that Earth system, going all the way back to what I was talking about with El Nino and La Nina. And we've also seen an increase in precipitation over the last century as well, especially here in Nebraska. We've seen, where I'm at, we've seen an increase in precipitation over the last 50 to 100 years. And then using those models, projecting it forward, we expect that the Earth will continue to warm, especially across the United States. And we expect that precipitation will continue to change as well, with certain parts of the US getting a little bit wetter and certain parts of the US getting a little bit drier. And then it all depends on the time of the year as well. So here in Nebraska, we expect that the winters will get a little bit wetter and that the summers will get a little bit drier. And not only will the averages over the entire year change or over seasons will change, we also expect the extremes to potentially increase as well. So the hottest days of the year will get potentially hotter, wettest days of the year will potentially get wetter, and then there's an increase in the potential for dry spells for certain parts of the US as well. And that's kind of what we've already seen. We've seen a change in our extreme events over the last 50 to 100 years across the United States. Not only have we seen increases in temperature, but we've seen more extreme precipitation, heavier downpours, more floods, especially in the Midwest and northeastern part of the US, more intense hurricanes, especially those large hurricanes in the Atlantic. We've seen sea level rise. We've seen more intense winter storms. We've seen droughts and more frequent and intense droughts in the western part of the US, more frequent and intense heat waves, and then also we've seen increases in wildfire intensity as well. So will changes in climate impact our health? Well, based off our first survey, I'm pretty sure that you guys I'll just leave this up here for a second. So we've identified that climate is linked to our health in some capacity, and any farmer who's working out there, anybody that's working on land, realizes the importance of climate on our health in some way. But changes in that climate and changes in our atmosphere and changes in our systems around us will also have the potential of impacting our health. And so in 2016, this document was released by the US government. This brought together experts throughout the federal government. We had experts from the Centers for Disease Control, from NIH, HHS, from NASA, from NOAA, the Defense Department, you name it, they were involved in it. We also had academics, medical doctors, nurses, and then even physicists and physical scientists a part of this report. And the whole premise was to understand the impacts of climate on human health and really do a full investigation of what are the impacts of climate on human health here in the United States. But then also, what is the impact of climate change as well? And so there are multiple findings through this report, but there were two main findings that I just wanted to highlight that I think kind of just solidify the findings of the report. One, that climate change is a significant threat to the health of the American people, and that every American is vulnerable to the health impacts associated with climate change. And the reason for that is that we've seen changes across our climate system all across the United States over the last 50 to 100 years, and we expect that those changes will continue in the future as well. And so this is from my colleagues over at CDC, and this is just showing all those different relationships between a change in our climate system and what that means for our health. And so, you know, you have sea level rise, changes in temperature, changes in CO2, more extreme weather. All of those things change the environment around us, and those changes in the environment around us can potentially lead to human health consequences. And I'll talk about some of these in a little bit more depth in just a second. So this figure here is basically the same thing as the spinny fancy figure before, but it's a little bit flatter and less fun. And so we have the climate drivers up at the top. That's our extreme weather, changes in temperature, changes in precipitation, all those things. And then we have our exposure pathway. That's the change in the environment. So poor air quality, reduced food quality, infectious disease, all these things, population displacement. And then that gets to our human health outcome down at the bottom. So the reason I put this figure up is for those gray boxes on the outside, the social and behavioral context and the environmental and institutional context. Social and behavioral is what's the demographics of the population where you live? What's the age, gender, race, ethnicity? What's the levels of poverty, housing, infrastructure? What's the education of your populations? What are potential discrimination issues that you're facing? Access to care and pre-existing health conditions. And then you have the institutional and environmental context. So that's what's the land use look like? What's the agricultural production look like? What's the geography look like? What's the infrastructure look like? And the reason these are so important is, one, these are the things that we can better understand to help put interventions in so we can reduce the potential health impacts when a natural disaster or climate-related disaster occurs. These are also the things that we can ignore, and we can potentially see greater impacts in the future as well. So they're definitely important for trying to address some of these issues. And then populations of concern. When we're talking about any natural disaster, you know, these are the same populations over and over again. Older adults, children, low-income communities, and communities of color. And we should also put in there occupation is incredibly important, because if you're somebody that's working in an area where it's you're more exposed to some of these events, then you're definitely going to be more impacted as well. And the reason for this is exactly what we were just talking about before. It's either underlying pre-existing health conditions, discrimination issues, lack of access to care, and you can just kind of go through the list. So the impacts of climate change are now, because I think a lot of times we get lost in that 20 to 50 to 30 to 100 years into the future. And one of the things that I've been talking about is that we've already seen a change in our climate system. So we've seen an increase in the frequency and severity of heavy downpours, floods, droughts, and major storms, which then can lead to injury, illness, displacement, and death. Vulnerable populations are basically anybody that's in the pathway of one of these storms, but certain populations are more vulnerable, as we talked about. These are people with disabilities, older adults, and then people that are living in areas that are don't have as much access to care as well. And we're seeing more of these events occurring. So we're seeing them coming back to back. So in 2012, around Missouri, they saw a very significant drought, and then 2013, they saw a very significant flood. And here in Nebraska, in 2011, we saw flooding in this part of the country, and then 2012, similar, we saw flooding or drought. And the costs of these are getting more severe. So from the 1980s, this is data from NOAA, from the National Oceanic and Atmospheric Administration. They've been reporting billion-dollar disasters over the last 30, 40 years. And so a billion-dollar disaster is basically a climate or weather-related disaster that exceeds $1 billion of economic loss. And then one of the things that you'll notice is we've been seeing an increase in billion-dollar disasters, and we've also been seeing an increase in cost as well. And that's partially due to population growth, things costing more, but it's also partially due to the fact that we're just seeing more of these types of events. We've also seen spreading of disease, higher temperatures, changes in rainfall patterns, disruption of ecosystems can lead to Lyme disease, West Nile disease. Vulnerable populations are basically anybody that's outdoors that can potentially be exposed to these potential vectors. And we've already been seeing a change in some of these diseases. We know that, for example, West Nile, which is here in Nebraska, is one of the more prominent areas where West Nile occurs. We know that West Nile is very closely linked to changes in our climate in some capacity. And we've known about that relationship, as we've talked about before, all the way back to the early 1800s here in the United States with Tilton, Dr. James Tilton, who was the U.S. Surgeon Army General. But we've also seen a change in things like Lyme disease. So we've seen the spread of Lyme disease across the United States. So this is data from CDC in 1996, and you can see where all the different cases of Lyme disease occurred. Each of those blue dots represents a case of Lyme disease. And this is in 2016. And one of the things, I'll just flip back and forth a little bit here. And one of the things that we noticed is that we've seen a lot of spread of this disease. And there's a variety of different reasons for that as well. But there's been a number of papers that have been done that have shown that changes in our climate system have also changed this the spread of this disease. Because these little ticks do well when weather is more mild during the winter. And then going to what the main focus here is the mental health impacts as well. So we've seen, especially with things like extreme events that can lead to stress, depression, anxiety, PTSD, suicidal thoughts. And this is basically, again, anybody is being affected by some of these major disasters. And we've definitely seen that here in the Central Plains part of the US as well, and other parts of the US. This area that I work on, it's understanding that relationship between drought and mental health. We've understood this relationship for a long time, that especially farmers and rural communities are directly impacted by some of these types of events. Australia, these are just two more anecdotal examples here, but Australia has definitely seen this to a great extent and really made this well known. Australia has faced some major droughts in the recently, and some of these major droughts have had significant impacts on the agricultural production in that country. And what they've seen in Australia was an increase in suicides in farmers and rural communities due to these drought events. And then also here in the United States, this is just, like I said, anecdotal, but they were talking about they were talking to a farmer about the alarming suicide rates and with farm workers, and he said nothing gets a farmer down more than a drought. And one of the things that we know here in the United States, and where this article came from, was, or where this particular thing here that was posted about this Kansas farmer was in association with what we see is a pretty high suicide rate and mental health issues with farming and rural communities. And so, like I said, this is some of the work that we've been doing. This is what I did with some of my colleagues at CDC and Emory University. We were looking at drought events and how we get from a drought event to mental health outcomes. So over here on the far left side, we have the drought, and over on the right side, we have depression, suicide, anxiety, and we have the pathways that we get to over those events. And I didn't put this up here to confuse anybody or make it look really complex, but it just shows the difficulty and some of the complexity with some of these relationships with drought and with some of these other natural disasters and how we get to mental health outcomes. So one of the things I really wanted to say was that climate change is local. A lot of times when we focus on this issue, we talk about places far off in other parts of the world. We talk about the Arctic, we talk about a variety of different things. But one, we should realize that climate change is here, it's in the United States, and it's in our backyard. But there are opportunities, and I don't like to end on a low note. There's a lot of work that we can be doing, and there's a lot of work that we are doing. This is some of the areas that I'm particularly focused on, which is educating the public, enhancing our monitoring of some of these issues, doing better research, and then contributing to the public dialogue so we better understand some of these impacts that climate has on our health, so we're better prepared today for what we're going to be facing in the future as well. And there's a lot of opportunity out there. These are all the different states that have climate action plans. Climate action plan is basically a way for the state to understand the impacts of climate on their populations and how to be better prepared for these potential impacts for the future as well. And a number of health departments are already receiving funding from the Centers for Disease Control and Prevention to work on the impacts of climate on human health. And so each of these blue highlighted states are examples of that. So just in closing, climate change is a significant threat to our health. Climate in general is, and so is it to the impacts on our mental health. All populations are vulnerable, but some populations are more vulnerable than others, more at risk. Cost of this is increasing. There's multiple relationships between climate and disease and mental health, and there's a lot by combining expertise and making sure that we're at the forefront of this. So with that, I just want to say thank you very much. If you have any questions, I'd be happy to address them. And if you're more interested in some of this information, please go to the Climate and Health report that came out in 2016. So with that, thank you very much, and happy to address any questions that you have.
Thanks, Dr. Bell. This is Stacy again. I do have a couple questions that have come in, and I'd welcome you to send some more if you have anything in mind right now that you'd like us to consider. First question, it seems we often see reports of deaths directly related to climate or weather events like wildfires, but less so the indirect deaths. Is this info easily accessible to the public?
That's a great question, and that's one of our biggest issues as well. It's a lot harder to get those that morbidity data, the hospital data, than it is to get the death data. So that's one of the reasons we have such a high focus on the death rate, but not on the number of hospitalizations. Honestly, there needs to be more work done on researching and understanding the impacts of climate on health outcomes that end up with hospitalizations or the direct or indirect or with the indirect or delayed impacts. Because you know, that's where we actually can make a large difference in trying to improve population, improve the health of individuals in the community. Is if we understand some of these relationships, that will then help with improving interventions that we're trying to do in the future as well. So unfortunately, you know, we're not there yet, and we have a number of regulations and restrictions on why we can't get, or why it's difficult to get some of the hospital data in a timely fashion to be able to better understand who are the populations that are being impacted. And that's why it's so important for us to do studies and do retroactive studies where we look back and look at certain events, understand those health impacts, so that the next time we see flooding, like here in Nebraska, where we saw flooding in 2011, and we see it again in 2019, who are the people that are impacted? Who are the ones that we potentially need to help when the next event occurs? And that's especially true of mental health and the issues associated with mental health, because those numbers and those statistics are even harder to get.
Okay, there are actually more than one or two people who have said, I noticed my state was not in the climate action. I'm gonna say that wrong, but their state does not have a climate policy, is not climate ready. I'm concerned. What do you recommend?
You know, I think the most important thing is engagement. Engagement with local leaders, political leaders, with your communities, and helping engage people on this issue. And as you'll notice, there's a variety of different states that have climate action plans. And there's a variety of different states that are working on some of these issues, but not all states. And so even here in Nebraska, this year we had legislation that was put forward to create a climate action plan, and it got close. It didn't get passed, but it got close. And I think it's just making a lot of these communities and some of these political leaders understand the impacts that this has. You can remove climate change from it, and you can just focus on the climate impacts. Like, we know that climate has an impact on our health, just based off of the survey that happened here. And so even though maybe, let's say, your state doesn't have a climate action plan, there's no reason that your local health department, your city, the town, your county, whatever it is, that they can't develop some kind of climate action plan and learn from some of the events that are taking place. And so I think through just communication and talking with your local politicians, talking with your local academic center, university, state college, whatever it is, there's multiple ways that you can attack this issue and try to figure it out. Because I guarantee you, in every one of these states, there's a number of people that would be interested in working on something like this and trying to get this information out to the general public. But because, I mean, most of us are concerned about the next time that Nebraska floods or your state floods. So yeah, so I think that's the easiest way to really try to get that going.
All right. There is a question on here. What experience have you had in interacting with agricultural producers and farmers? And then can you tell us more about what types of conversations they have been receptive to having?
Yeah. So I've definitely had a number of conversations and engagement. I'm from a small rural town in Nebraska, and so I'm definitely familiar with talking with farmers and talking with producers about some of these potential impacts. You know, honestly, I've had a lot of luck talking to individuals, and maybe I was just because I'm fortunate. You know, if I'm talking about extreme weather, if I'm talking about climate variability, I've never had much pushback on that. And honestly, and I've even worked with like military, and I've worked with a variety of different folks, and that seems to be like the area that everybody can kind of agree with. And a lot of people will agree that something's changing, that the climate's changing. And a lot of times people just don't, you know, it's that link back to human cause. Honestly, I don't care how we get to the conversation. I just want to get to the conversation, because my concern is about how this is changing and the impacts that this has in the future. You know, I'm much more about the preparedness. I'm concerned in trying to get to the point where we can do more mitigation, where we can reduce our greenhouse gas emissions, because I know that that's important, but we're already in a changed climate. We've already seen a change over the last 50 to 100 years, especially with our extreme weather events. And so if we're not thinking about how we address those changes in our extreme weather events today, you know, we're still going to be facing those in the future. And I feel like that conversation is everybody's pretty receptive to that. Now, but you know, you're talking about the mitigation or reduction of greenhouse gas emission. That's where, you know, some people get a little bit more, where the conversation isn't as easy moving forward.
Okay, I think, sorry, I'm going through the questions and trying to make sure that I kind of touched on all of them. There was another along that same line, but when you're looking at multiple factors that impact mental health, how does the science show climate change is a contributing factor or the root cause above another factor?
Yeah, you know, it's like with anything, it's always hard to say that climate change is the cause of mental health. And that's not really where my work is trying to go. My work is more, climate is a potential contributing factor to mental health. If we change our climate system, then that could potentially lead to more mental health outcomes, negative mental health outcomes because of future climate events, especially extreme weather events. And so, but anytime you're talking about mental health, like something like mental health, which is much more of a delayed or indirect health impact associated with, let's say, a natural disaster like flooding that happened here in Nebraska, it's hard to say that flood necessarily even caused the mental health outcome, because, you know, you think about it, you know, you get hit by the flood, and then, you know, it might be weeks, months, or even years later that you're still trying to deal with some of the impacts. And then also, and this has been with some of my conversations across the state where we try to get suicide data so we could better understand some of these relationships with some of these extreme weather events. And, you know, sometimes it's not reported, especially in rural communities, because of life insurance claims, because of stigmas attached to it. And then also on top of it, you know, when we're talking about farming communities and rural farming communities, I'm definitely familiar with that. You have the stoic farmer that feels like they can take this on themselves, and so they don't necessarily go and seek help because of potential stigmas associated with it, or just a lack of access to care as well. So yeah, it's difficult to understand some of those relationships, but there have been some good studies that have shown those relationships as well. Drought in particular, one of the earliest studies that I've ever seen linking drought to mental health and suicide was here in Nebraska back in the 1980s, when that big significant drought that occurred back in 88 or 85, I forget. And they were able to link that they saw an increase in suicides in farming communities.
All right. I'm hoping we at least touched on your question. We would welcome you to follow up more with us. If you have any follow-on questions, you can reach out either directly to Dr. Bell, or you can send me an email as well, and I can connect you. I know you get my emails with all the reminders and stuff, so feel free to use me as a conduit, and I'll help you get to the right people. I think we've made it through all of them that I see right now. So we'll wrap up for today. Thank you all very much for participating, for giving us your feedback and asking some really great questions. It's great to hear from you. Thanks for interacting with us. Thank you, Dr. Bell, for being here and for sharing your work with our audience today. Have a great afternoon, everybody.
Thank you. I appreciate it.